What is the role of psychiatrist in pain management?
Well, the role of psychiatrist is very important because pain, as total pain, has physical but also emotional component. So, in many pain patients, there are psychiatric comorbidity. And it is really necessary to, we can differentiate pain patients, let's say, in two groups. One is the patient, one of the patients who really suffer from the chronic pain, and because of the chronic pain, they developed chronic pain syndrome with insomnia, with anxiety, with they are tired, exhausted. Then it is really necessary to treat the pain correctly, but also to support the patients with psychological treatments. The other big group of the patients are the patients primarily with the psychiatric diagnosis, with the depression, with the PTSD, with anxiety disorders, somatoform disorders, sometimes with psychotic symptoms, where the pain is the symptom of psychiatric disorders. Then it is really necessary first to treat psychiatric problems.
Is it possible to treat psychiatric problems?
It is possible because pain is one of the most common symptoms of depression, or for example, patients with chronic post-traumatic stress disorder. So if we treat those disorders, the pain will be lower. And there are many roles of psychiatrists. I mean, there are many ways how psychiatrists can help. First, of course, is pharmacotherapy. Because many psychotropic drugs are co-analgesics. And then psychiatrists can help in prescribing those drugs together with other specialists. The other very important thing, of course, is psychotherapy. Cognitive behavioral psychotherapy, sometimes psychodynamic approach, relaxation techniques, hypnosis, etc. But also psychiatry is important in the teaching about the patient-physician relationship, about the coping strategies, about different reactions of the patients to the pain, and also in education of the public and the other general practitioners. So we have also, things to do in let's say, psychosocial, in social things.
And if the patient doesn't have psychiatric comorbidity, only small depression, do we need psychiatrist in this case?
Well, sometimes we need psychologists, let's say, who will help with some basic techniques or with some, but really then, of course, then we don't need psychiatrists for all patients. But in chronic pain patients, there are more than 60-70% of them with anxiety, depression, mild to moderate. And then really psychological approach is very important, because without it, probably we will not succeed in our treatment.
Which psychotherapeutic method is the best for headache treatment, tension type headache?
In headache treatment, references shows the effectiveness of cognitive behavioral psychotherapy. Because patients can learn some behavioral techniques, and patients can learn about, during the sessions there are discussions about the bad cognitions that cause some tension headache or other headaches, and they learn how to cope with the pain. But in some patients with some personality disorders, and some patients let's say, other psychiatric problems, psychodynamic assessment sometimes can quickly help to find where is the problem. So in some patients, psychodynamic approach is also useful.
And which pain condition is most respondent for psychotherapy? Can you tell that?
Especially in low back pain, in chronic low back pain, in chronic pain conditions. Then also in chronic tension headache.
And also cognitive behavioral therapy?
Cognitive behavioral therapy mostly, yes.
Mostly used. Thank you very much and wish you good luck.
Thank you.
you.
It was okay.